There are many patients who recognize allergy symptoms when they are obvious to the patient, but there are a lot of patients who are not aware of the fact that there are allergy symptoms that they may have that in fact they don't recognize as being allergic based. Most commonly, for example, would be the concept of irritable bowel syndrome. Well, most people don't think that irritable bowel syndrome may be allergic based, but it can very well be due to a chronic, what we call delayed food reaction. So we have immediate food reactions, immediate allergic reactions, and delayed reactions. The immediate reactions, for example, you eat a nut, you have an immediate swelling of the mouth, the lips, etc., the throat, you stop breathing, you have to be in the emergency room. That's an obvious. We call that an immediate hypersensitivity reaction, or what we call anaphylaxis. That's an easy one to detect, but there are a lot of patients who are not aware of the fact that they eat a food today, and certain foods react not immediately, but delayed, 2 to 3 days later. So they may very well have symptoms that they may recognize as being allergic 2 to 3 days later, or they may have, more commonly than not, allergic symptoms that they're not aware of. For example, manifestations in the gastrointestinal system, or the muscles, or the heart, or the brain. That's where the key of interpretation, that's why it's so imperative to be able to go ahead and do a blood testing to identify the specific allergy antibodies that are causing the problem, or maybe in fact causing a problem the patient is not even aware of. When allergy is not treated, that affects the nasal sinuses, eventually chronic sinus inflammation takes place of the inside of the sinus, what we call the mucous lining of the sinus and of the nose. In some cases, polyps develop. In some cases, chronic inflammatory disease ensues. What we do in our practice is evaluate the source of the problem by evaluating the specific allergy source of the chronic sinus problem. But in addition, in some cases, surgery is necessary. And in those cases, we're able to perform microscopic sinus surgery through an endoscope, through a tiny little scope that gently is introduced into the nose and into the sinuses to clean out the sinuses, to identify the problems inside those sinuses, and to correct those problems. The beauty of endoscopic sinus surgery, or what we call functional endoscopic sinus surgery, is that the amount of bruising is markedly diminished, the pain is almost nil, and the recovery time is extremely quick. We encourage you to look at functional endoscopic sinus surgery. Allergy skin scratch tests only identify the reaction on the skin of an item placed underneath the skin. It does not identify the specificity of the antibody. The only thing that you can identify on the skin is an immediate reaction, for example, an IgE or immune globulin E type reaction. There are many other kinds of allergies which cannot be identified using the skin scratch test. The blood test is very specific and accurate in that it checks the actual antibody that may be causing the problem, specific to the particular food or the particular airborne item in the air. The beauty of the allergy sublingual immunotherapy program, or what we call allergy drops, is that we can treat food reactions with allergy drops. You cannot use shots to be able to give you desensitization for foods. We can also treat with allergy drops airborne allergies as you would with shots. But the beauty is the patient administers the drops themselves. It's convenient for the patient. It's safe. It's not uncomfortable like shots. And it's not as cumbersome in terms of the treatment modality because the patient administers the drops themselves.
Well, recently I had chronic ear problems, inner ear infections that all the other doctors had tried to treat in ways that never worked. And so following my ergotomy I had as a child and the problems that ensued with that, and then the tympanoplasty to try and repair those problems, I came here because it wasn't solving it. Now, through just a very much less invasive process, there's no drainage whatsoever, haven't had any pain involving it, no sensitivity after being in water, just 180 degrees the other way in comparison to the way it used to be.
We had just moved into the area from Dallas, and I was having a problem with allergies. I could tell I was just sneezing a lot. I was uncomfortable. My eyes were swelling shut. During the time when I came, and I just explained to him that I'd gone through allergy testing before where we'd lived, and I had done the scratch testing on my back, where I had 60 of those done on my back, and then like I can't remember, like 18 on each arm, and that was very uncomfortable, and it never improved. It never really got any better, even though I stayed on the allergy shots for 2 years. And then after I came to Dr. Rubenstein, he gave the blood test to find out what things I was allergic to in this area. And come to find out, it's a lot more accurate. I'm doing a lot better, and I could tell a major improvement within 3 months. Having the appropriate diagnosis and finding out exactly what I was allergic to, it has enhanced being able to think much more clearly, because I was so taken by the sneezing and bothered by it, because you can't concentrate very well when you're constantly carrying on and your eyes are swelling and getting the major bags underneath the eyes. That has just made a big difference.